Hi, my name is Mark Lubitz, and I'll be guiding you through this week's medical research update. First off is an article about a 70-gene signature test used to determine what kind of treatment to use for breast cancer. This product called MammaPrint, which is a 70-gene signature test, has already been proven to help predict outcomes in women with early-stage breast cancer. This study in particular looked at women who had a high clinical risk breast cancer, but whose genetic profile showed a less severe risk. This study showed that about 46% of women with a high clinical grade breast cancer might actually not benefit from added chemotherapy, thus being a useful study to determine the course of treatment. This next trial studied the effect of focused ultrasound thalamotomy on essential tremor. The data was acquired by having patients with essential tremor fill out surveys regarding their quality of life at certain endpoints going up to 12 months. These patients were also looked at by independent neurologists who didn't know whether they had been treated with a real focused ultrasound thalamotomy or a sham procedure. This study showed that focused ultrasound thalamotomy for patients with essential tremor did reduce symptoms of essential tremor and increase quality of life, with minor side effects such as sensory and gait disturbances. Per capita spending on prescription drugs is higher in the United States than anywhere else in the world. In 2013, the average person spent about $850 per year on prescription drugs, whereas in the other industrialized countries, the average was around $400. This is largely because of the monopoly powers given to drug companies by the FDA after a drug is released. They have a certain time period where nobody else in the market can make the same drug, thus protecting them against getting massive losses from all the research and development that they do. However, studies have shown that there is no direct correlation between the amount of money spent on research and development and the cost of a certain drug. They let the market decide the price of the drug. Thus, a drug that might not cost that much to develop could still be very expensive if the market will allow for it. It's also difficult to negotiate the prices with the drug companies because certain payers like Medicare and Medicaid are sometimes required to pay for any drug that is needed for a certain disease. Increasing competition in the drug industry, enhancing negotiations between the drug industry and payers, and hopefully better patient and physician education about the cost effectiveness of certain therapies should help with this problem in the future. These next two trials have important implications for the treatment of asthma. Previously, long-acting beta agonists have paradoxically been shown to increase the risk of asthma death and asthma hospitalization in children. This first trial looked at the addition of a long-acting beta agonist salmeterol to fluticasone, which is an inhaled corticosteroid commonly used to treat asthma. In this study, the addition of the long-acting beta agonist salmeterol to typical fluticasone therapy did not lead to a statistically significant decrease in asthma events. This next trial was extremely similar to the last trial, however, it studied two different drugs. This next trial studied the addition of the long-acting beta agonist formoterol to the inhaled corticosteroid budesonide. This study actually did have a statistically significant result showing that the addition of the long-acting beta agonist formoterol actually decreased the number of asthma exacerbations in adolescents and adults with moderate to severe asthma. However, it did not decrease the absolute number of serious asthma events. To clarify that, they decreased the overall number of exacerbations, but not the number of serious events. Overall, it looks like the addition of long-acting beta agonists to asthma therapy has a very unclear role right now, but theoretically and according to some data may provide some benefit. This next trial has important implications for HIV prophylaxis in couples where one of them has HIV and the other one does not. This trial showed that early initiation of antiretroviral therapy in couples where one of them has HIV and the other does not led to a significant and sustained decrease in transmission of genetically linked HIV. This study, which ran from 2011 to 2015, showed that early initiation of ART therapy decreased the likelihood of transmitting the HIV by 93%. There were actually only 2 cases that were transmitted from one couple to another while the partner was taking antiretroviral therapy early on. With intensive HIV testing and early access to ART, this has the potential to significantly decrease HIV rates throughout the community. Thanks for tuning in. Check back soon for more.